Okay, so we are team number one. The topic that we present today is about the SSRIs and depression. Okay, for the depression is caused by the physical changes and an imbalance of the brain chemicals along with other factors. The depressions start between the ages of 15 and 36. Is especially the prominent in the women. The SSRIs, which mean the selective serotonin reuptake inhibitor, the first choice in the treatment due to its ability to block the reuptake of serotonin at the brain receptor. SSRIs and other therapies can lead to the higher chances of recovery.
Depression is characterized by an interference with person's ability to work, sleep, study, eat, and enjoy one's pleasurable activities. Symptoms can include depressed mood, loss of energy, feelings of worthlessness or guilt, impaired concentration, insomnia, recurring thoughts of death or suicide, and significant weight loss or weight gain. There is no significant cause of depression, but several factors may lead to its onset. MRIs have shown differences in the brains of depressed individuals. Areas responsible for regulating mood, thinking, sleep, appetite, and behavior tend to function abnormally. In addition, levels of neurotransmitters appear to be out of balance. Depression can sometimes run in families, suggesting genetic link to the disease. However, depression can also occur in families with no history of depression. Trauma, loss of loved ones, difficult relationship, or any stressful situation may lead to depressive episode.
Most antidepressant medications work by increasing the levels of neurotransmitters in the synaptic cleft between neurons in the brain. Neurotransmitters targeted by antidepressants include serotonin, norepinephrine, and dopamine. Serotonin is thought to regulate other neurotransmitter systems. Low levels of serotonin promote low levels of other neurotransmitters. Lack of serotonin can lead to anxiety, obsessions, and compulsions. Lack of dopamine can affect attention, motivation, pleasure, and interest in life. Lack of norepinephrine can affect alertness, energy, anxiety, attention, as well as interest in life. Regulation of serotonin levels. Serotonin, or 5-HT, is converted from L-tryptophan by tryptophan hydrolysase. That's TPH. Levels of serotonin are dependent on the following: low levels of L-tryptophan, impaired synthesis or release, increased reuptake or metabolism levels, serotonin postsynaptic receptor abnormalities. SSRIs are selective serotonin reuptake inhibitors. They decrease the reuptake of serotonin from the synaptic cleft. TCAs are tricyclic antidepressants. They decrease the reuptake of serotonin and norepinephrine from the synaptic cleft. MAOIs are monoamine oxidase inhibitors. They inhibit monoamine oxidase, thus preventing the breakdown of monoamine neurotransmitters.
Here we have a diagram of the synapse. Above is the presynaptic cell, below is the postsynaptic cell. Serotonin is released by vacuoles into the synaptic cleft in the middle, where it is subsequently removed by selective serotonin reuptake proteins. SSRIs target presynaptic serotonin reuptake proteins in the brain. They're indicated for antidepressant and anxiety, personality disorders, premature ejaculation, and insomnia. Common side effects include nausea, sexual dysfunction, dry mouth, headache, diarrhea, nervousness, rash, agitation, restlessness, increased sweating, weight gain, drowsiness, and insomnia. Common drugs include citalopram or Celexa, escitalopram or Lexapro, fluoxetine or Prilogy, fluoxetine or Prozac, fluvoxamine or Luvox, paroxetine or Paxil, and sertraline or Zoloft.
Citalopram selectively inhibits serotonin reuptake, thus yielding more serotonin for receptor binding, resulting in better mood. Citalopram is the S enantiomer of the racemic derivative citalopram. It has no or very low affinity for 5-HT17 alpha and beta adrenergic, D15, H13, M15, and benzodiazepine receptors. It selectively inhibits the reuptake of serotonin with little to no effect on norepinephrine or dopamine reuptake. The citalopram does not bind or has low affinity for sodium potassium chloride and calcium ion channels. Depoxetine, considered to be connected to the inhibition of neuronal reuptake of serotonin and the resultant potency of serotonin action. Fluoxetine selectively inhibits serotonin reuptake. Fluoxamine Drug of choice for obsessive compulsive disorder, inhibits 5-HT reuptake in brain. Metabolized CYP2D6 mainly. Photosensitive 2 should be protected from sunlight to lose antidepressant activity. Paroxetine is mainly used for bipolar depression. Atypical depression inhibits 5-HT reuptake in the brain, metabolized by CYP2D6 mainly. Potent in nature, so carefully watch in elderly patients, has narrow therapeutic index. Switching to other antidepressant requires at least 15 weeks of washout period. Sertraline is mainly used for bipolar depression. Atypical depression, anxiety disorder, inhibits 5-HT reuptake in brain, metabolized by CYP3A4 mainly. Carefully taken with imipramine because causes inhibition of CYP2D6 and lows imipramine activity.
Okay, so what did we just talk about? What are SSRIs? SSRIs are classified as selective serotonin reuptake inhibitors. Usually use these for depression, which is characterized as a chemical imbalance in the brain, generally a lack of serotonin. SSRIs work by targeting at the presynaptic serotonin reuptake protein. So basically what they do is they block serotonin reuptake proteins, allowing serotonin to stay in solution and to be reused again. SSRIs are generally used for anxiety, depression, personality disorders, premature ejaculation, and insomnia. Some common side effects are nausea, sexual dysfunction, dry mouth, diarrhea, nervousness, headache, rash, agitation, relentlessness, sweating, weight gain, and drowsiness.